Hi, my name is Danielle Hausman. I'm an occupational therapist and rehab educator here at the Craig H. Nielsen Rehabilitation Hospital. Thank you for watching this video about what is a spinal cord injury. Please pause your video and read this important disclaimer. Thank you. Here are the objectives that we'll go over today. We want to understand what a spinal cord injury is, know how an injury is named, and understand the main purpose of the inpatient rehab recovery process. So the most important thing to know and the most frustrating thing up front is that every person's recovery is different. Your medical team will do their best to make educated predictions based on the location of your injury and the extent of your injury, but every recovery is unique. When a spinal cord injury occurs, messages are disrupted not only at the level of the spinal cord injury, but messages below the spinal cord injury are disrupted as well. And this can impact movement, feeling, bowel and bladder control, sexual function, temperature regulation, which is called thermoregulation, as well as blood pressure control. Because of very specific reasons related to your spinal cord injury, your blood pressure may be high, something called autonomic dysreflexia. A spinal cord injury can also cause blood pressure to be low, which is called orthostatic hypotension. And here are some statistics to make you realize that you're not alone in all of this, that every year in the United States, about 18,000 new spinal cord injuries will occur. And currently, there's about 300,000 people living in the United States with a spinal cord injury. But most of those people are living happy, functional, productive lives, but certainly have needed to find certain ways that are different to do certain things. And the average age of onset of a spinal cord injury is around middle age, age 43. And an interesting fact is that about 80% of people with a spinal cord injury are men. So naturally, a lot of the research and interventions are geared towards males. And here in this graph, you can see the most common causes of spinal cord injury. So by far, the most common cause are motor vehicle accidents, followed by falls, acts of violence, sporting events, and lastly, non-traumatic spinal cord injuries, which make up about 10% of all spinal cord injuries. And within this category, this would include things such as spinal stenosis, myelopathies, cancer that's either in the spinal cord or near the spinal cord, as well as spinal cord strokes. And as our population is aging, this category of non-traumatic spinal cord injury numbers has increased recently. Initially, after a spinal cord injury, the spinal cord will go into what's called a period of spinal shock, also known as neurogenic shock. And during this period of time, the spinal cord stops functioning for a period of time. And so in the very early days after injury, it can be difficult to know what actually is damaged within the spinal cord versus what signals are just being blocked from all of that extra swelling. And in general, spinal shock will resolve within 2 to 3 weeks. It can last anywhere from several days to a couple of weeks. And there are two main categories of spinal cord injuries. The first one that we'll discuss is called tetraplegia. So this is when an injury has occurred in the neck or in the cervical spinal cord. So this was formerly known as quadriplegia. So the terms tetraplegia and quadriplegia are interchangeable, but tetraplegia is a more updated term. And tetra means 4. So with this type of injury, both arms and both legs will be impacted from the spinal cord injury. The other main category of spinal cord injury is paraplegia. And this is when the spinal cord injury occurred in the back. So either in the thoracic, lumbar, or sacral spinal cord. And para means 2, so this means that 2 limbs were involved, most commonly both legs. And the chest and stomach may also be impacted depending on the exact level of the spinal cord injury. And an injury is named based on a couple of different factors. So first is the injured section of the spinal cord. So cervical, thoracic, lumbar, or sacral. And the second component is the number of affected spinal nerves. So to break it down, for example, an L2 injury means that an injury occurred at the second nerve in the lumbar part of the spinal cord. And then next, the ASIA impairment scale is used by the medical team and the therapy team to determine how complete or incomplete a spinal cord injury is. So this is a very thorough exam that's done on both sides of the body. During this exam, sensation is evaluated by doctors evaluating something called dermatomes. So dermatomes are areas of your skin that represent specific parts of spinal cord function, and so the doctors will look at things such as light touch, deep pressure. They'll also evaluate the sensation in your butt. And then through this exam, doctors will evaluate muscle strength by evaluating something called myotomes. So myotomes are groups of muscles that are controlled by specific parts of the spinal cord. So once this assessment is completed, the doctors will assign a second letter to the injury. And an A injury means that there isn't strength or feeling below the level of the injury at the time of the exam. A B classification means that the injury is sensory incomplete. So in other words, there's some feeling but not strength below the level of the injury, and that you can feel at least your butt. A C injury means that there's some feeling and some strength below the level of your injury, so it's called a motor incomplete injury. And then D would be even more feeling and more strength below the level of your injury. And then E is a spinal cord that has completely healed. So as you can see, as you go farther down the letter scale, that represents more sensation and more strength as you go through the recovery process. So looking into the future, we know that the ASIA score can potentially change over time. And so as you notice new and significant changes to your sensation and to your strength, make sure that you let your medical team know, because it may be appropriate to reassess your ASIA exam. We know that nerves do have the potential to regenerate, but it's a very slow process, slower than anyone wants it to be. And being here in inpatient rehab is just the first step of your rehab journey. So the main goal of inpatient rehab is to make it so that you're able to go home or to your next setting and be safe. And we want you to be as independent as possible. So this might mean you being able to do some or all of your cares on your own. And for cares that you need assistance with from a caregiver, we want you to be as independent as possible in directing those cares so that you still have control over your body and your cares. And we know that while you're going through this rehab recovery process, due to a spinal cord injury, you're at risk for several health complications, mainly related to your skin, bowel, and bladder. And so it's important to participate in lots of different education opportunities so that you can learn how to prevent these complications from happening, so that you can just focus on rehab and moving on to the next step. So we hope that you'll watch lots of our videos and participate in lots of different types of education opportunities. Please contact your primary care team with any questions that you may have. Thank you for watching this video.